Welcome to exercise testing. So before you got to this point, you've already learned about everything about the hearts, about the physiology, about how metabolism, nutrition, all this stuff, how everything is good for us, all this random stuff about the body. You've already learned all these things. So now in this class, this actually takes everything you learn and puts it in perspective and how every single thing we do and all this physiology and every anatomy that we learned, how it's actually relevant to real life, and how our actions when exercise and our actions and lifestyle choices can actually affect this little guy, this heart, and affect our lifestyle, and it can save a life. And if we neglect our lifestyle and everything, it can kill us. So that puts everything into perspective, and this is how certain factors, certain criteria play into effect in our health and in our health. And that's what this whole class is about. So this is of course the hearts, beautiful heart, and the main thing in this class that is on every single exam, and the main thing that you have to learn from this, if you enter any field in the health industry, you're going to have to know these. You're going to have to know this. It's the 8 risk factors, and these 8 risk factors aren't just in this class, something to memorize. These are prevalent in medicine and physical therapy and everything. Because cardiovascular disease now is the #1 killer in America. It's no longer cancer, acute diseases where they just strike you and like kill you instantly. It's all chronic diseases that happen over the course of a lifetime, 20, 50 years, whatever, and you slowly build up to these diseases, which can be devastating. And the thing about all these diseases is they're all preventable. It's all from lifestyle changes. And that's what these 8 risk factors are, and that's essentially what this class is. And by now, you know exercise is good for you, and it prevents these diseases and chronic and cardiovascular diseases, or diseases that affect this guy, are the #1 killer in America, and of course also preventable, 100% of them. So first, we'll go over the 8 risk factors, and these 8 risk factors are the foundation of everything in exercise physiology and everything in medicine. Is these 8 risk factors. These 8 risk factors classify individuals based on how likely they are to have a heart attack in the future. May not mean they'll definitely have a heart attack if they have all these risk factors, or if they're at risk, but their percentage to have a heart attack increases greatly. So there's 8 risk factors. And then we'll go over at the end what these risk factors mean, how you classify these risk factors, what you do with these risk factors. But you have to know these factors because on every exam, she asks many different case studies involving these risk factors, critical thinking questions involving them, because they're all very important in your life and in other people's life. So you can actually use this information to be healthy and live longer. So the first risk factor, we're doing red, but the first risk factor is just age. Very simple. The older you are, the more likely or the more at risk you are for a heart attack. Just because that's the way the body is. The heart is a muscle. It beats hundreds and thousands of times a day, or millions, or more than a million times your life. So it's natural that with every single passing year, it gets weaker. I mean, if you contract your biceps 80,000 times a day, eventually they're going to get weaker. It's the same thing with the heart. It contracts every single day, multiple times a minute. I don't how many times it beats a minute or a day, but it contracts a lot. So basically, every single year it gets weaker, regardless of what the hell you do, what train, it gets weaker. That's just part of it. Now, the thing is, for men, the age starts to be a risk factor when they get above 45. So at 45 years, once men pass 45, it's a risk factor. So it means if they're 45, it's a risk factor. If they're 46, it's a risk factor. Regardless of how much you exercise, or how healthy you are, or how good your lifestyle is, if you're above 45, it's a risk factor. For women, it's a little different. Women have more protection than men. So for women, it's not above until you're above 55. So if you're 55, it's a risk factor. If you're 56, it's a risk factor. But if you're 54, age is not a risk factor. The reason being because women, they go through something called the menstrual cycle, all that stuff with estrogen. They produce estrogen, progesterone, everything, and men do not produce estrogen. And estrogen is beneficial. It's protective to the heart. The exact reason, I don't really know. I don't think anyone actually knows the reason why it's protective, but it's protective. And at 55, that's when they go through menopause, most of the population, so then they don't have that protective benefit anymore. Now, the second risk factor is family history. if someone in your family has had a heart attack or a cardiovascular related illness or surgery or whatever, that puts you on a risk factor. Just because I don't want to say everything with the heart is genetic, but if like 3 generations have had a heart attack before a certain age, that puts you in a predisposed risk for a heart attack. It doesn't mean you don't have a heart attack, but it puts you in a higher risk. You're more likely to have one than someone who has no heart disease in their family, just because it's somewhat genetic. Now, for family history, for men below the age of 55. So it doesn't matter if you're a man or a woman, but if your father or your first degree relative, that's just your brother. So if your father or brother has had a heart attack or any cardiovascular disease like bypass surgery, heart attack or bypass surgery really, before the age of 55, so if they've had cardiac arrest, which just means your heart stops beating and you're dead. If they've had cardiac arrest or a heart attack or open heart surgery or something before the age 55, well, that's mostly they probably didn't have that because of age, they had because of lifestyle changes, choices, so that puts you at risk. Just so, for instance, my grandma had a heart attack, had a heart diseases, heart problems when she was like 45. So that automatically puts me at one, that gives me one risk factor, even though I live a pretty healthy lifestyle, just because I have a relative, or actually that's not my first degree relative, so never mind, forget that. But that puts my dad at risk because his mom has had a heart attack before age 55. Now for women, well not for women really, but for age 65, so if your mom or your sister has had a heart disease before age 65, that's a risk factor, because remember that protective benefit of estrogen. So this isn't saying if you're a man or a woman, it only applies to both of them. Regardless of if you're a man or woman, if your father or your mom has had a heart attack before age 55 or 65, it puts you at risk. And that's just how it is. Now if you notice, these two risk factors are non-modifiable. Non-modifiable. I believe that is a question, or is just something worth knowing. You can't do anything about these risk factors. You can't control your age. You can't control your family history. Those have already happened. You have no control of these. You have control of the other 6 risk factors, the lifestyle change, but with these you have no control. So regardless, you can have 2 risk factors regardless. You have no control over these. Your age and family history, that's already happened, that's in the past. But you can control the future and these other risk factors. So the other risk factors, we'll switch to black. The other risk factors, the third one is, well, this is the easiest one, physical activity. If you have some exercise in your life, that is beneficial, regardless of if you think it's not enough exercise or whatever, who cares, as long as it's exercise. Your body doesn't care what you're doing as long as you're moving. But there is a criteria for to be considered this not be considered a risk. As long as you exercise at least 3 days a week, for 30 minutes a day. So there is somewhat time difference, but this 30 minutes a day doesn't mean 30 minutes straight. It can be like 10 minutes walking, rest, 10 minutes walking, rest, whatever, as long as it equals 30 minutes a day for at least 3 months. So this is very simple how I memorize this. I just remember 3, 3, 3, or just 3. As long as you're active 3 times a week for 30 minutes a day for at least 3 months, that means you're not at risk. Now, if you're anything below this, that means you have one risk factor for physical activity. Now, number 4 is also pretty much an easy one that everyone should know, smoking. Obviously, smoking is bad for your heart. It's bad for every single system and organ and everything in the body, but specifically it's bad for the heart. Now, the criteria for smoking is you had to have at least quit in the last 6 months. So like if you quit 3 months ago, you're still at risk for heart disease. Or you're at a smoking risk. You're always going to be at risk regardless if you smoked in your life, just because smoking is not bad for you. But if you've quit like 5 months ago, that means this is not a risk factor. Well, it's not in the final tally that's used to determine other things. But if you quit like 7 months ago, it's not a risk factor. If you quit 5 months ago, it is a risk. But of course, smoking is bad in general, so never smoke in your life. It's bad for every organ and tissue, and every single disease has a root in smoking. It's just bad for you. So smoking, physical activity. So these are 4 risk factors so far. Now the other risk factors also, like all these risk factors are kind of, you can think about it and like, oh, I've heard about that before. But another risk factor is hypertension or high blood pressure. High blood pressure. Now, if you have high blood pressure, it puts your heart at a risk because your heart has to work harder to maintain living. And if your heart has to work harder, you can just see how many times the heart beats during a lifetime. Eventually, it's going to fail and get weak, and that's not good. So you're giving your heart undue stress that it does not need to be doing. Now, the cutoff for heart disease, or the risk, is 140/90. If you're above 140/90, that's hypertension. Well, that means stage 1 hypertension, whatever. Now, normal is 120/80, and we'll go over into the different levels of heart disease or whatever. But 120/80, we'll just write it. 120/80 is normal, which means 121/139 is considered pre-hypertensive. What this means is you're in danger for being hypertensive or having high blood pressure, and you're in the danger zone. So do something with your lifestyle, or else it'll be considered a risk. Now, in my opinion, anything above 120 is bad, but you should do something to lower it. But 121/139 isn't considered a risk factor. You don't count it as a risk until you enter 140 or 90. Now, that's considered pre-hypertensive, but a pre-hypertensive client is not considered to have a risk. So that's 5 risks. So we'll clear that. Now, the next one is called dyslipidemia. And what that means is, dys means bad, or it's a negative term. Lipid means fat. Emia means condition. So dyslipidemia means a bad condition of fat. So your levels of fat or cholesterol, which is also a fat, are not ideal. Now there's 3 types of lipids in the body, or there's more of course, but the only 3 that we really care about. There's LDL, HDL, and cholesterol. Of course, LDL and HDL are a type of cholesterol, they're a subdivision, but maybe we'll just say total cholesterol. But okay, so LDL is the bad cholesterol. The higher LDL is, that is bad for the heart. You want to get this as low as possible. And the risk factor is above 130. If you have above 130 in the body, that's very bad. The higher you get, so the worse it is for your heart. And we'll talk about atherosclerosis and coronary artery disease later. But essentially, the more LDL you have, the higher your risk increases exponentially. And LDL is the bad dude. You want to lower it. Now, LDL is lowered by, now this isn't really important to know, but if you have high LDL and you want to lower it, you might need to know this. LDL is really controlled by your diet. If your LDL is high, it's because your diet sucks and you're eating shit, so you probably should stop eating it. So processed foods, fried foods, all that stuff, that's LDL. Exercise doesn't really affect LDL. Now, HDL is considered the good cholesterol. So the more HDL you have, the more beneficial it is. It's like the protective guy in your body that goes and kills all the bad things in your body. The LDL, the plaque, everything. So the more HDL you can get, the better. Now HDL, let's say the risk factor starts below 40. So once you get below 40 HDL, that's considered bad. That's considered a risk. And now if you have high HDL, that's really beneficial. So if your HDL is above 60, that's actually a negative risk factor, and that means you take off one of these risks, which we'll calculate all at the end, so all these risks will make sense. Now total cholesterol is like a rough overview in the body. You just look at one number. Now LDL and HDL are a type of cholesterol, but you can't just add LDL and HDL and get your total cholesterol. That's not how it works in the body. There's many other types of cholesterol. There's high subdivisions, HDL2, HDL3, HDL4, high density HDL, low density HDL, all that stuff. So there's many cholesterol in the body. So you can't just take these 2 numbers and add them together. That's not how it works. But if your HDL is greater than 200, that puts you at risk. So you want your cholesterol. You want your cholesterol below 200. Now, your cholesterol is composed of HDL and LDL, so exercise helps. raise HDL, and diet helps lower LDL. So just live healthy. It's kind of, you all know how to live healthy, it's just an act of doing it. Now another one, this is 6. Another one is obesity. Obviously, we know obesity is bad, and it's a major problem in America. We're one of the fattest nations in the world, and obesity obviously is not good for the heart. But the cutoff for obesity is through a guy called BMI. Now, BMI stands for Body Mass Index, and if your BMI is above 30, that is bad. If your BMI is above 30, that's the classification. That means you're obese. Now, you can calculate BMI, and we'll go over that later, but if your BMI is above 30, you're obese. Do something about that. Exercise, eat healthier, stop smoking, do something. Don't get liposuction or surgery. That's not an answer. That's not a fix. 8 is one, like these other 7 you can easily think of if you just start thinking about it, but 8's a little different. 8 is prediabetes. And just like prehypertensive, I spelled it wrong. Just like prehypertensive, where you can be in a danger zone to be prehypertensive, and then you're actually hypertensive, prediabetes is the same way. Prediabetes, of course, means if you're diabetic, that means you're diabetic. You can't process sugar. You continuously have a high blood sugar in your body, which is not good, because that leads to many other problems with the body, mostly cardiovascular problems, but also problems with your eyes, your muscles, your feet falling off, not good. So diabetes is bad. Now, this is measured by looking at your blood sugar with the theory, or not the theory, the idea that diabetes means you can't metabolize sugar in your body. So you get sugar in your body, your body uses sugar as energy, from metabolism and exercise physiology, and you get blood sugar, and your body metabolizes that by releasing insulin, so you can absorb the sugar, you can be happy, you have energy, your cells have energy. Now, in a diabetic, they don't produce insulin, or the body is not receptive to insulin. It's insensitive, so the insulin doesn't work. They've had so much insulin over such a long period of time because their diet sucks ass, and the body is just no longer effective to it. It has a tolerance to insulin. Just like when you have a tolerance to alcohol, you drink a shit ton of alcohol, eventually you have a tolerance to it, and the same does not cause the same effect. Same thing with insulin. You have a tolerance to insulin. So your blood sugar can be high over a long period of time. Now, normal blood sugar is below 100, and whenever you're hungry, it's because your blood sugar is very low. So everyone's had low blood sugar before. Normal blood sugar is below 100. Now, you always take this test after you've been fasting, so 8 hours at least since you've last eaten. The reason being because in 8 hours, you should have lowered your blood sugar below 100. Of course, after you eat like 3 or 4 hours, your blood sugar is only above 100. That's normal because you just ate. But 8 hours on, your blood sugar should be below 100. Now, the risk to be pre-diabetic is 100 to 125. And we'll put the units of blood sugar, of glucose. This glucose sugar, same thing. You have to just take a finger prick to tell this number, but if your blood sugar is between 100 and 125 after you've been fasting for 8 hours, that means you're pre-diabetic. That's a risk factor. Now, if it's above, wrote that guy wrong, but if it's above 126, that means you're diabetic. That is no longer a risk factor. That just means you're a high risk for cardiovascular disease. Now, these are the 8 risk factors. So we'll very quickly just list all 8 risk factors. You have age. Age, if you're above 45 for men or if you're above 55 for women, you're automatically at risk. Nothing you can do about it. 2 is family history. If your father or first-degree relative, which is your brother, has had a heart attack or a cardiac condition before age 55, that puts you at risk. If your mother or your daughter or your sister, since you probably don't have a daughter at this point, has had a heart attack or cardiovascular disease before age 55, you're automatically at risk. You cannot do anything about these. These are non-modifiable. This is what life has given you. You cannot do anything about it. Spelling it completely wrong. But you cannot do anything about these diseases. So, not these diseases, these risks. So don't even pay them attention. If you have them, you have them. You can't do anything about them. Now, the ones you can do something about is smoking. Obviously, don't smoke. Horrible for you. If you've been smoking within the last 6 months, it's considered a risk factor. If you quit 7 months ago, it's not a risk anymore. Oh, the other one, which another thing she does is try to trick you, is secondhand smoke. well, no, I guess she's not really trying to trick you because it's also true. If you're around smoke, it's a risk factor. Even though you don't smoke, secondhand smoke. So if you're around friends who are smoking, say fuck you, get out of my life, stop smoking, stop killing me. But that's a risk factor if you're around secondhand smoke. 4 is hypertension, if you have high blood pressure. And again, I'll write down the thing since that's a really popular number to know. 140/90 means you're hypertensive, you're at risk for heart disease. 5, very easy, physical activity. Just remember our good old 3-3-3 thing. You exercise 3 times a week, 30 minutes a day for at least 3 months. 6 is dyslipidemia, a condition of messed up blood thingies. So you have LDL, you want above 130, HDL you want above 40. No, that's the good cholesterol. I mean LDL you want below 130, sorry. HDL you want above 40 in total cholesterol. So we'll just do TCL. You want below 200. And then 7, obesity. Of course, you don't want to be obese. America is not doing too well on that, which is why we're one of the highest, why heart disease is the highest #1 killer in America. Totally preventable, yes, #1 killer in America. Obesity is BMI above 30. 8, prediabetes. If your blood sugar is below between 100 and 125, you're pre-diabetic. That means you're at risk for diabetes. You want to do something with your lifestyle, eat better, exercise, do something. Now, another risk for prediabetes, above 100 and 125 is glucose. Just measure someone's blood glucose. If they fast, you measure the glucose. Another test is called the oral glucose tolerance test, OGTT. And what this means is they give you a shit ton of glucose, and then they immediately measure your blood sugar every 2 hours. And the idea is, of course, your blood sugar lowers, but if your blood sugar within those 2 hours is between 140 and 199, I don't know where they got these numbers, but if it's between 140 and 199, that also means you're pre-diabetic. So it can either be someone's blood sugar they give you, or they give you an oral glucose tolerance test. It's 2 tests, they tell the same exact thing. So these are the 8 risk factors. Based on these risk factors in another video, you add them up and say, oh, this person's above age 45. They smoke because they're stupid. They're hypertensive. They do not exercise, whatever. You just add up all these risk factors and you can calculate their disease or their percentage chance that they might have a heart attack in the near future. Can't put, just because someone has all 8 risk factors, that's obviously terrible, but that does not mean they may ever get a heart attack or cardiac condition. Someone can have no risk factors and have a heart attack and drop dead within like 10 days. Again, these are just risk factors. They increase your percentage. Life is like that. Someone can be perfectly healthy and have a heart attack. Someone can be the most unhealthy person in the world and not have a heart attack. It's just how life is. There's nothing you can do about it. But you can make certain choices to fix them. And this whole class is about choices and how you can be protective against the #1 killer in America. So this is a very good class to actually pay attention in because it can save your life.